Hello everybody, welcome back. Today our topic is asthma attack. Asthma attack is one of the hyperinflation syndromes. What are those hyperinflation syndromes? They can be permanent, can be transient. Permanent in case of the COPD, which is the chronic obstructive pulmonary disease, or transient like the asthma attack. What is the definition of an asthma attack? It is a common, chronic disorder of the airways that is complex and characterized by variable and recurring symptoms, airflow obstruction, bronchial hyperresponsiveness, and an underlying inflammation. The interaction of these features that we've mentioned of the asthma determines the clinical manifestations and severity of asthma and the response to the treatment. What is hyperresponsiveness? It is an exaggerated bronchoconstrictor response to a wide variety of stimuli that do not necessarily determine bronchoconstriction to a healthy person. A major but not necessarily unique feature of asthma, hyperresponsiveness. What is the mechanism of this hyperresponsiveness? Inflammation, dysfunctional neuroregulation, and structural changes. Hyperresponsiveness is not equivalent to asthma, is normally present in the convalescence of the viral respiratory infection. Let's talk about the pathogenesis of the asthma attack. The pathogenesis, interaction between the host and the environment. What in the host and what in the environment? In the host is the innate imbalance of the immune response, Th1, Th2, the cytokine response profile. As in the environment are like allergens and respiratory infections, diet, perinatal factors. Asthma attack has an onset in childhood, earlier in the boys than in the girls. The diagnosis of the asthma attack. To establish a diagnosis of asthma, the clinician should determine that episodic symptoms of airflow obstruction or airway hyperresponsiveness are present. Airflow obstruction is at least partially reversible. 3. Alternative diagnoses are excluded. It's important to note that airflow obstruction is at least partially reversible. Okay, what are the recommended methods to establish the diagnosis of an asthma attack? 1. A detailed medical history. 2. Physical exam focusing on the upper respiratory tract, chest and the skin. 3. Spirometer to demonstrate the obstruction and assess the reversibility, including in children 5 years of age or older. Reversibility is determined either by an increase in the FEV1 of more than or equal to 12% from baseline, or by an increase of more than or equal to 10% of the predicted FEV1, forced expiratory volume, after inhalation of a short-acting bronchodilator. Additional studies as necessary to exclude alternative diagnosis. So these were the recommended methods to establish the diagnosis of an asthma attack. What are the different triggers of an asthma attack? These include 1. Environmental and occupational allergens, which are numerous. 2. Infections. 3. Exercises. 4. Inhaled agents. 5. Emotions. 6. Aspirin. 7. Gastroesophageal reflux. And 8. Menstrual cycle. Triggers. What about the triggers of the home-related allergens? Let's talk about the home-related allergens. Dust mites, cockroaches, pets, irritants, environmental tobacco smoke, air pollution like the sulfur dioxide, and the ozone. Let's talk about history taking of an asthma patient. It is not only for asthma patient this history taking, but also for all types of diseases. When a patient comes to you, you take history to know information which will help you diagnose the patient. You should take careful personal history of respiratory and cardiovascular diseases. Thank you for watching and looking forward to see you in the next video with a new topic.